Hello and welcome to Unit 4. In Unit 4, there will actually be a two-part series, and this is the first of the screencast for Unit 4. In this lecture, we will be discussing evaluation of teaching materials and methods. By the end of this course week, learners will be able to explain in 1 to 3 sentences the purpose and importance of evaluating teaching materials and methods, identify at least 5 items to include in an evaluation of teaching methods and materials, and identify at least 3 ways to evaluate teaching methods and materials. So when we discuss the evaluation of teaching materials and methods, it's important to understand the reasoning for this. Based on these methods, we are able to determine program effectiveness. They may be summative or formative. They may be informal or formal. There are a multitude of evaluation methods, and it is recommended as we are evaluating our teaching materials and methods that we use multiple methods in assessing the effectiveness of the program. So, what are we going to evaluate? As we are evaluating a student, we will be looking at written material. We will assess this for clarity, sizing, spacing, colors. Also, with visual materials, we will also assess for clarity, size, and color. When the student is providing a verbal presentation, we will assess for clarity, speed, volume, confidence, and knowledge of the topic. With a visual demonstration, we will assess for clarity, easy to follow, the speed at which they are doing their visual demonstration. And does the written, visual, and verbal information match one another? Also, we will assess the environment. Is the noise level appropriate? Is the lighting appropriate for the presentation? And is the room temperature adequate so that the student can listen and learn? Is the content relevant? Is it applicable or appropriate for the audience? Are we providing unnecessary or necessary material? And are we missing information within the lectures? Is the length of the lecture and/or presentation correct? Is it too long or too short? Are we providing the appropriate amount of practice and/or hands-on time? Do the learners believe they actually achieve the learning objectives after the lecture is complete? And did the session keep the learners' interest? Most importantly, based on that lecture, does it allow them at this point to develop critical thinking and clinical reasoning? Will it influence their practice for change? Does the student appear to know how to utilize this information, and do they feel confident in their ability to utilize the information that's being presented within that lecture and/or course? So ways that we can evaluate the effectiveness of a teaching program is through peer review and/or coaching. We can self-reflect. We can ask questions to prompt the student. We can have the student write questions, and we can write questions for the student. And then, as most of you may know if you take students, there are fieldwork forms that we can complete when we're assessing the effectiveness of the student's participation within the fieldwork. So in peer review coaching, it's recommended that the student get aligned with an experienced peer and/or mentor and work with that student, work together on areas that need to be improved. I know recently with my last student, when we met at midterm, I provided areas in which she should improve, and I asked her to come to that meeting with areas in which she could improve. And then after that, I left her with a task of outlining what she could do to improve in those areas of weakness. So as a peer and as an instructor, We will work together to discuss, review, and the findings, and will collaborate on the strategies for improvement. As an instructor, it's important that we self-reflect. Think about the time in which we provided the material for the student. Was it adequate? Did we provide enough verbal information versus all written and or visual? Did I keep the interest of the learner during my presentation? Were the students actively participating in the lecture? Were they actively engaged in the discussion? Was the environment positive? Was it a positive learning environment? And as an instructor, did I include all the necessary resources, or should I go back and seek additional resources to support that lecture? And then, most importantly, look at ways in which you could change your methods and or materials in order to enhance that course or that presentation for the student. So when we question the learner, this is to, ask the opinion of the learner. Ask them, are they receiving what they need? And this can be done through a survey or a focus group. Who should conduct this? Should this be from, the student themselves developing questions and or working with other students to assess their effectiveness within the fieldwork? And how might be the best way to question the learner? So when we write questions for the learner, again, we're seeking the opinion of the learner. This can often be done, and most of the time is done through a form or a survey. Typically, these can be done, in a written form or on a computer. It's important that they have some open-ended questions to allow the student the ability to provide more information than just simple, yes, no, or on a scale of 1 to 5. Rate certain activities about the course, and always leave space for comments and suggestions. The American Occupational Therapy Association has developed self-assessment tools for the fieldwork educators, and there is a midterm fieldwork experience assessment tool and a student evaluation form. These are all linked within this unit. So how frequent should we have the evaluation? An evaluation of a student clinical and or of a course should be done at the completion of the course or at the completion of the fieldwork. Ideally, after a group patient education course, again, that's where you would seek information about how well did people perceive this continuing education course. And it's not feasible to do an assessment after every patient education session. I know in our practice, we have patients rate their experience at the conclusion of their therapy. What do we do with the evaluations? Well, we should take a critical look and look at common complaints and or suggestions and decide on changes to make based on the feedback. It's very important to review the information that's provided and make those changes to the course. And with repeated evaluations, what you can do is determine, okay, so if I make these changes and then I assess after the next course, hopefully I will see a valuable improvement. Hopefully the students will have perceived this as being, a better course as compared to last semester. And then again, always making changes as needed to make that course even more appropriate and more student-centered. So in reflection, which now after being at Rocky Mountain, that's a big part of what we do in our learning. It's, what else can I do in my teaching methods? What should I do more frequently and why? And are there other options that I could provide within this course to make this a better course for the student? These are the references for the first part of the screencast for Unit 4. And Please let me know if you have any questions, and I look forward to presenting Section 2 for Unit 4. Thank you.